Welcome to our weekly Next Chapter Brain Injury and Stroke recovery group. We have William Yan with Duke University talking to us about seizure recovery and the postictal state. And so we thank you so much, William. Take it away.
Thank you, Ms. Falal. Hi, everyone. My name is William. I'm a sophomore at Duke University studying biology. So today I'll be talking about seizure recovery and postictal state. So first, let's define seizure. A seizure is defined as a burst of uncontrolled electric activity between the neurons that cause temporary abnormalities in the muscles and movement and behaviors. So as you can tell, if there's abnormalities in the electricity in the neurons, it's going to send some wrong signals that's going to cause some very serious consequences. So in seizure, it comes in different flavors. So one main thing you can have is a focal seizure, which is something that originates in one area of the brain. And this is 80% of TBI-related seizure complications are actually focal seizures because of the impact is in one area and the seizure developed from that area of the brain. And inside focal seizure, there's simple focal seizure, which don't involve the loss of consciousness, and complex focal seizure, which can cause the loss of awareness. And the other general type is called the generalized seizures. So that spreads over the entire both hemisphere of the brain, and it involves many different subtypes such as tonic-clonic, absence, atonic, myoclonic, and tonic seizures. And if you look at the distribution, the statistics here, 60% of the seizures are focal seizures, with 20% having non-epileptic seizures, which is a psychotic disease, and there's another 30% with generalized epilepsy. Well, as I was presenting, I just noticed that these numbers don't add up to 100. So I'll look into that and see what's up with that. And okay, so if we think about the type of seizures, we have this psychogenic non-epileptic seizures, PNES, and that is like I said, a psychological disease that mimics epileptic seizure symptoms. And it includes some clinical displays of convulsions, loss of consciousness, and abnormal movements. And that is caused by not because of a brain injury or a specific abnormality of neurons, but rather a psychological distress, trauma, or unresolved emotional conflict. So move on to the generalized seizure. There are different types. So one of the main type is myoclonic seizure, which is defined by quick jerking movement of the limb. This is a very classic, typical response of seizure if you think about it. And another type is a tonic seizure, which is also called drop attacks. It is a sudden loss of muscle tone leading to falls and collapse. And what's interesting is that if you look at the right, this is the electroencephalography diagrams of seizure patients. And with different type of seizures, you can see different electric patterns in these patients. So some other types of generalized seizure has tonic-clonic seizures, which is characterized by stiffenings, which is the tonic phase, followed by the jerking, which is the clonic phase. And there's also the absence seizure, which is brief lapse of consciousness, often mistaken for daydreaming. And some common symptoms are staring blankly, eyes blinking, and slight movement. And the reason why it's called absence seizure is that it doesn't have postictal state. Okay, and then diving into the cause of focal seizure, brain injury, especially traumatic brain injury, is one of the major cause. Also, birth abnormalities. There's also infections like meningitis, These increase the risk of focal seizures and also brain tumors and causes unnecessary pressure in the brain, which disrupts the brain structure in the local region. And moving on to the cause for generalized seizure. Of course, we have genetic factors that always plays a role in most of the disease. Mutations will give predispositions and increase the likelihood of experiencing seizures. And also, focal seizures can progress into generalized seizures as the symptoms spread across the brain and go to the other hemisphere. Other causes include brain abnormalities, metabolic disorders, and environmental triggers. So stress, lack of sleeping, all of these, and using recreational drugs can increase the risk of generalized seizure. Okay, so let's move on to postictal state. So postictal state is the state of consciousness that occur after a epileptic seizure. The word ictal means seizure and postictal means after seizure. So some examples of this postictal states are confusion, disorientation, drowsiness, fatigue, and the duration of the postictal state typically ranges from 5 to 30 minutes, but with severe one having to last for several hours. So some of the types of postictal states are postictal migraine. This is very common, and other symptoms are less common, such as the TOTS paresis. That's a temporary regional loss of the function in whatever region that just experienced the seizure. And there's also postictal psychosis, which is a neuropsychiatric sequel of seizures and chronic epilepsies that leads to delusion and hallucinations. And after seizure, there's also something called postictal bliss or euphoria, where the patient will suddenly feel really good about themselves. And then moving on to the diagnosis of seizure, there's a physical examination, of course. The jerking motion and these clinical presentations are really important for the diagnosis of seizure. And another important tool is the EEG, electroencephalogram. That is the diagram that I showed you a couple of slides ago, which shows you the electric pattern in the brain. And these patterns can tell you a lot about not only if you have a seizure, but also the type of seizure that the patient experienced. Imaging studies such as MRI and CT scans are also helpful in testing for the structural abnormalities, and also blood test is often used as it can track for electrolyte abnormalities and infections and genetic factors that I talked when I was talking about the causes of the seizures. Yeah, so I think Dr. Glenn was the one who brought up this topic, and he was wondering why they check inner ears for seizure. And that was actually very interesting when I was doing the research. One of the main reason is that vestibular system, which Anne talked about a couple of months ago, it is the system that allows you to orientate yourself and know the location, rotations, and keep you in balance. It's the main part of the vestibular system is the inner ear, and through this movement of the fluid in the inner ear, we're able to have a spatial awareness around us. So this vestibular system plays a role in seizure, which leads to vertical dizziness and imbalance. So, which is one of the reasons why they want to check the inner ear during seizure. And another reason why is because inner ear problems, as you can tell, with vestibular system being disrupted, it leads to vertical dizziness and everything. And these symptoms are very similar to seizure. So they want to check the inner ear to make sure that it's not an inner ear problem, but rather a seizure when doing the diagnosis. Okay, so last but not least, we have some treatment, which is also called antiepileptic drugs. One of the common type is sodium or calcium channel blockers. As we know that as neurons are sending the signals, the sodium channel and the calcium channel are essential for these electric impulses to pass on. And by blocking these, it allows us to inhibit the neurons from being super active. Another way to do it is the GABA enhancer. And we know that GABA is an inhibitory neuron. Whenever GABA binds to a neuron, it stops the neuron from having electric activity. So by enhancing these inhibitory neurotransmitters, it reduces the neuronal excitability. Another thing is called the glutamate receptor antagonist. Glutamate receptors are known for it's very active. It causes a surge of electric impulses afterwards. And by blocking that, we can block the electric signal and prevent the neurons from being hyperactive. And last one I thought is really interesting. It's called GABA transaminase inhibitor. So these does not do anything on GABA receptor per se, but what it does is that what our normal brain would do is after GABA is transmitted to the next neuron, there will be some enzyme that chop up the GABA and digest them at all, so that there's no neurotransmitters remaining in between the two neurons. But here, since what we want is we want to consistently silence the neurons that comes afterwards. We want to actually leave these GABAs inside, and we do not want to digest it as quickly. So what these type of drug does is that it inhibits these digest enzymes so that the GABA keeps remaining in that region, so it can inhibit the neurons that comes afterwards. Yeah, so that's it for my presentation, and I'll open up